Thank you. I wanted to ask how family members, how we can take care of a mother who has gone through post-depression after giving birth. Thank you.
Once again, postpartum depression is the one thing you need to know. There are so many types of depression. As much as here somebody has depression, we have major depressive disorder, which is very common. We have seasonal depression, which comes at some time. You might find somebody have, in the course of the year, some few months, they have here this or that. So depression could be classified, but the only good thing is that men don't get postpartum depression. So it's only for women. So what I'm talking about is that this specifically, so I don't want you to see a man who has the following signs and symptoms and you say this postpartum. Now what I'm saying, the issue of postpartum is when it could even be before, during pregnancy, that you hear somebody changes because of the hormonal issues, and again what they're also going through. Some of these issues could be dated back into their childhood experiences, so they are just erupting. And for people who don't understand this is when somebody becomes depressed and they have the following symptoms. First, they have delivered, they feel like they want to commit suicide, get out of life. Maybe they want to eliminate the kid. Maybe they are suffering. They have issues with sleeping, they have issues with appetite, they have issues of self-worth. You know, when you get somebody has a child, it's joy, isn't it? They feel happy. So this time you find somebody, it could occur as early as 2 weeks, could occur later, but the symptoms are like, one, they feel they want to, they have, they lack pressure with what they used to like, and they have, they might disclose themselves or maybe try to distance themselves with the baby. I have heard of several who have had issues with their babies, and I remember one of the cases I was called for was a lady I went to. I went to the bedroom because she was not feeling that. Actually, she was laughing at her best. The next minute, she has now the depressive part, and again she says she has not delivered. I remember it's basically 2 weeks. She says she doesn't have a baby and all this. What I'm saying is, the modern way of approach in terms of handling that is what we call biopsychosocial. One of the things you need to weigh is the risk. Like when I went to that place, I weighed the risk. As much as psychology is a talking therapy, this person's emotions need to be addressed first. So that's why he's saying the bio part of it is when the doctor handles that. You hand over maybe to a guide will be able to give a guidance or say if it requires sometimes it has psychosis. So you need to find out how to refer to another person, and when you refer to the medical doctor, actually to someone who can give medication. That's the bio part of it. Then from there you take this person to the psychologist. The psychologist now, the person is already handled in a way they can attend the session, and they can make, so nobody is at risk. The mother is not at risk, the child is not at risk. Then from there, as a psychologist, I will be able to find out what support or challenge is the person getting with the people they are living with. What are the fears? What are the challenges? So that you'll be able to do that. So there isn't one model of taking care of that. It's a multi-sectoral approach that the doctor does their work, the psychologist does their work, and again the society now, the people they live with, does their work. Is that answered?